Good evening. An exclusive story for you now on potential changes to what you are covered for under OHIP. City News has learned the Ford government is considering cutting or saving close to $500 million from services and potentially reducing MRIs, pain injections, and even coverage for your colonoscopy and sedative for it could be cut back.
Here is the list of services the government has submitted to be evaluated for reductions or cuts. Going for a colonoscopy, the sedation currently being offered could be cut unless certain criteria are met. That would save $16 million. Funding to remove certain polyps found during the colonoscopy could also be cut, saving $9.2 million. Injections for pain management, known as nerve blockers, could be reduced to 4 visits a year, saving $51 million. Limiting psychotherapy to 24 hours a year saves $13 million. In all, 28 services are on the list for potential savings, including diabetes management, echocardiograms, and tonsillectomies. All are under the lens of what is being called an appropriateness working group, made up of doctors from the Ontario Medical Association and government officials. And the clock is ticking. The deadline for the group to agree to $100 million worth of reductions is May 1st. Less than 4 weeks from now. The next deadline to save an additional $360 million is September 1st. If an agreement isn't reached by each date, documents show it will go to an arbitration panel, which will determine where the $460 million in savings will be found. OHIP services haven't been examined carefully in years because doctors were without a contract. This working group was part of their new agreement to find savings. Sources tell City News it is looking at the latest and best practices to see what tests are unnecessary, overused, and/or inappropriate. As much as 30% of medical services in Canada are unnecessary and inappropriate. And adds, there is evidence that less than 4% of Ontario's family doctors are responsible for ordering nearly 40% of tests of low value. This appears to be why MRIs for middle-aged people's knees could be reduced to save $2 million. The document states they have become routine, and most patients improve within a few weeks or months. Unnecessary tests clog up the health system, but of course the Ford government is also looking to cut costs. Health is the largest expense in the provincial budget, coming in at close to $60 billion last year. That's 42% of all provincial program spending. The minister did not give City News an interview for this story, but the opposition did.
If it's being done for the purposes of medical advances or new knowledge, that's one thing, and it's something that I think we would always expect to be happening constantly. But putting a price tag on it, putting a savings target on it, that makes me very worried, and it should make Ontarians worried too.
As for how the appropriateness group is progressing, we did get a statement from Health Minister Christine Elliott, which reads, in part, she is extremely encouraged by the progress that has been made, and adds, we wouldn't want to presuppose the outcomes of those discussions, but we know the focus will be on evidence and best practices and how we can improve outcomes for patients. Ends with, we will continue to put the patient at the center of the discussion.